Hey, everybody. Hope everything's going well. I have some things that we can do, but first off, let's just take some questions from the group. Anything goes. Feel free to unmute or type in.
Hello, good afternoon. I went to the local Sprouts and I usually buy my vitamins there. And when I ask about black cumin, they said, no, we have black cohosh and we have this, but we've never even heard of that. And I thought, well, maybe I didn't write it down correctly or didn't hear it correctly. So I think it was an anti-inflammatory, if I'm not mistaken.
Mm-hmm.
How do you spell that, please?
Black cumin,
Yeah.
C-U-M-I-N. Sometimes in the health food store, they'll call it black seed.
Yeah, that's what I was gonna say.
But that's the only variation. Yeah. They just might not have ever carried it.
Well, I cook with cumin or comino, which is unground cumin, but that's different.
Yeah, it is different. Yeah, I mean, they're similar, but the black cumin is different than regular cumin.
I'm sure, but I was surprised when they said they'd never heard about it.
Yeah,
Okay,
I mean, it's relatively popular these days, but not everybody's probably carrying it. So I would imagine most, but
black seed is often
black seed is the other thing that they call it.
Okay, I'll look for it. Thank you very much.
Yeah, you're so welcome.
Hi, Greg. This is Miriam. Hi.
Miriam who?
Thank you. I don't know.
How you doing? How's the weather up there in
I'm melting. I'm in Maine. It's 94, 90.
Wow.
Yeah, I am absolutely melting and we don't have air conditioning here.
That last time I was there, I think it was the hottest it's ever been when I've been there.
Yep.
Yeah, it was pretty hot. So
yep.
How are you doing? How's Dave?
Okay, we're both doing well. I've got a question for you about a friend of mine. She's about 70. She's just been diagnosed with Parkinson's.
Okay.
And this is the 5th year that she's been on a watch. And finally they say that there is enough, what is the expression? Expansion, was that the word? Enough, it became significant enough. She's been put on dopamine treatment.
Right. So you wanted to know like how to augment that? Well,
yeah, she's a pranic healer and she is doing the protocols for herself and she likes them very much, but she wanted to use oils. So she can follow a protocol.
So how old is she? She's about 70?
She's about 70.
And has there ever been any significant like physical traumas in her life or anything like that?
The same as everyone else.
Okay. No big nasty fall, no big nasty car accident, anything like that?
I don't think so.
Okay, let me look at my notes for a second. Okay, so we're sure that there was never any significant head injury?
Not that I know of.
No concussion or anything like that. Okay.
Not that I know of.
Let's have you ask her whenever you work out, talk to with her again, or ask her just to make sure.
Okay.
And then also ask her about her sleep.
Her sleep is, she's now doing melatonin. Her sleep is affected. I'm also noticing that her digestion is affected, and some lymph nodes, some lymph congestion.
Okay. With a case like this, I usually do case by case basis. There's not like really a set template that you can follow, just because the condition can be multi-causal in nature. And so give me just another minute to like tap into her a little bit.
Yeah, and she says that there was some question about whether her father that was never diagnosed but had some tremors.
Okay. You have the brainwave kit?
Yeah, you mean like the Delta Alpha?
Right. I'd probably have you have her work with that, start with that.
And that those protocols that go with it?
Well, let's just have you do real simple. Let's have you start with Delta, then go Theta, then go Alpha, then go Beta, then go Gamma. And awareness just on her brain and then her crown. That's it.
Okay.
Like I'd say 30 days of that, and then let's reevaluate. Sometimes you tackle other things other than this, but she's going to be on the medication or is on the medication now, and sensory nerves can be an issue, and usually there's some sort of sleep issue, sleep disorder. But I think this is a good way to start. She's in the early stages, and let's just see if we can't stop it or even reverse it a bit with just doing what we're doing. And so have her keep doing the healings, especially delicate regeneration on the brain. Yeah, if I remember right, there is a protocol for that as well, for Parkinson's.
There is one. There is
yeah.
one. I did look it up. There is one for Parkinson's.
Yeah. And yeah, let's just have her stick with that, do the brainwave stuff.
Okay, so you said Delta, Beta.
No, Delta, Theta, Alpha, Beta, and then Gamma.
I posted it in the
Yes,
chat.
I see it.
Yeah,
Okay,
and that's very specific order.
Okay, very good. And so doing all of them.
All of them in one sitting.
In one sitting, say 10 breaths, 25?
Yeah, 10 to 20. Yeah.
Okay.
But brain and then crown.
Brain and then crown. Okay. Got it.
And then after 30 days, bring it to my attention to get all reevaluate.
Okay. Great. Thank you.
You're so welcome. So Dave, bye.
I will. Hi, Sam.
Hey, Miriam.
Anybody else?
Yeah, go ahead, Robert.
Hey, Robert.
Hi. So I have several related questions.
Yeah, fire away.
When we're in class, you always take us through each application twice. Is that
For the
something?
chocolate. Yeah, for the chocolate classes. It's just to drive it a little bit deeper, you know.
Okay.
Um,
So will we do that with clients when we're doing non-chakra
if
related stuff?
you could, I mean, probably with clients, I'd probably just do one cycle first and let them get used to it. I mean, you guys are getting, you guys are like Marines, you know, like you guys have been doing it for a while. You've seen a lot of stuff, right? And so new people, if you feel that they can handle it, you could do it. It's pretty intense work. If you're not doing like several segments at once, you could go deeper on that, like doing two cycles. But if you're covering a lot of ground, I'd probably just do one cycle.
Okay.
Yeah.
Now, after or during classes, when you allow us to share our experiences, there's times where I have deep experiences and I could articulate them, but there's always someone who articulates things they feel or sense. But am I right in understanding that we don't need to know something?
No.
It just still happens.
Yeah, like you know, part of the thing about articulating it is, you know, I want people to share experiences, so there's a little bit of validation for the students, but a lot of times it's even bigger than what you articulate. And so if you're not really sure, that puts us all in the same thing together. I mean, you know, I've been doing this for years, and sometimes I go, oh, I think it does this, and then later I go, it does way more than what I thought.
Okay.
You know, and so that's pretty normal, you know, because you're really tapping into part of your brain that is not active in the normal everyday world, and you're awake and tapping into it. And so it takes some time for the brain to be able to process it.
Okay.
Yeah.
And then the last question, and we sort of touched on this during classes, is when you give a list of oils for a specific application, is the blend always better than the single oils?
Most times, every once in a while, something like aloes or poplar, or some fancy oil might be a little bit stronger. But especially with the chocolate classes now, we're doing with the little tiny bottles. Those are pretty A plus as far as class, the class goes. And so in some of the other classes, it might have not been the case, but for here, if there was something stronger, I usually do that instead. A lot of times the blends are to try to do something without having to spend, something for a fancy oil. And so, but on the chocolate classes, I kind of threw that whole philosophy out the window and just gave you guys A plus stuff. And, sometimes there's just like a mill in the bottle, but
it looks like 4 drops.
Sometimes.
Yeah. I think the least I've ever put in has been about 12 drops, something really, really pricey, but it's
So
usually
then,
about 12, like 20 drops is about a mil. And so sometimes we, try to factor it all in, and, 12 to 20 on some of the real small ones, but if we can go big, we'll go to the whole 2 mils.
Okay. And then sort of on a similar vein, when we're in class and there's the list of oils to use for a application, how do we know which one is better to choose over the others? That hierarchy, as someone said.
Sometimes they do slightly different things, but they're all for the application. If they make the list, they're doing that particular aspect pretty similar. And so most times the blend is the strongest. But every once in a while there's an exception. It's not many times. Most times the blend is the strongest. And so for them to be listed, those are usually A choices. And then when I start verbalizing other oils you can use, they'll start to be like kind of B and C choices. I don't like to put a lot of the B and C choices down on paper because I want people to get maximum results. But we still also have to factor in that sometimes people don't have the oil on hand. And so, I let them make notes about it or something.
Okay. Thank you.
Yeah, you're so welcome. Have you been enjoying the classes?
Oh, I definitely have.
Yeah, good.
You talk about being Marines. It's like a regular
Right.
dose of healing.
Yeah, yeah. I mean, we're not just learning it. It is a therapeutic. I mean, it is a treatment weekend. You know, we're doing
Yeah.
therapy. Yeah. Good for you.
Thank you.
Petrie?
Hey, how are you?
Hi. Hi, Greg. Can you
Another
hear me?
North Andover person.
I know. All the New Englanders are calling you. So I have
Mhm.
a couple of questions.
Fire away.
I'm going to be starting to work with new clients. And
Oh, great.
yeah, and one of them has this acid reflux with mucus.
Yeah.
And then in addition to that, she has very low blood pressure and very low pulse,
Okay.
and she passes out,
Yeah,
randomly.
that's pretty low. Yeah, that's
Yeah.
pretty low.
Yeah.
So let's tackle that first. The best thing to do for that is hyssop. Just the
Okay.
good old fashioned plain hyssop, any of the types. And that one, I probably wouldn't use the decumbens. And remember that Solomon's is a blend, Solomon's hyssop. So the Croatian, the Spanish, the Bulgarian, any of that will work for this. And the reason that it works for this is the hyssop is a stimulant to the medulla oblongata in the back of the head,
Mhm.
which helps to regulate circulation and some heart function and some respiratory function. And so usually there's something a little bit off with the medulla, and that's causing the low blood pressure. And so like if you just give them long, slow, deep breaths, daily of the hyssop. And I would probably even have them put like 3 or 4 drops on their wrist. You can make them a little roller ball that they can rub on their wrist, or, get them a little bottle of hyssop, whatever you want to do there. But an inhalation and probably a few drops on the wrist, and then have them rub the wrist together.
Okay.
That should help the blood pressure a lot. If it doesn't, let's talk about this again. Then we need to be a little bit more aggressive. But usually low blood pressure can be knocked out by hyssop.
Okay.
And so, it's nice because hyssop doesn't necessarily raise your blood pressure, but it definitely regulates low blood pressure.
Okay.
There's times where if their blood pressure hasn't gone up, I do start to have them continue with the hyssop, but I start adding things that might slightly raise their blood pressure. In the essential oil world, there's not tons of things, but there are some things. You can give them a little bit of cinnamon and have them take it internally. It doesn't raise the blood pressure too much. It might be a few points, but it does help to improve circulation. And so one of the concerns could be that there's some congestion in the veins. And so is there any water retention that you know of? Like, does she have puffy legs, puffy ankles?
I don't think so, but recently she went through a lot of other things, and she's going through some depression because of a loss, and she started taking prescription
Sure.
drugs, and so
Yeah.
she started to gain weight. So maybe at this point
there's probably some water retention there.
Okay.
And so you can tackle that a couple of ways. You can just start off with something like lovage or juniper, parsley, something like that. All of those are diuretics, but there's one oil that is a really super good diuretic, and it breaks up the blockages in the veins, and it helps to break up blockages in the lymphatic system. And it does have the diuretic effect, and that is sandalwood. It breaks up also blockages in the pelvis, so if there's any sort of like circulatory blockage or urinary tract blockage, anything like that, she will start peeing more. You can just start her on like maybe 1 or 2 drops in some water and have her drink it. Topically, unfortunately, won't really cut it. You gotta kind of have her take it internally for at least probably 2 to 4 weeks. And then after that, I usually follow that up with switching them off sandalwood and then going on parsley. And so we're going to talk at the end of July, we're going to do a free weekend where we talk about how to do a really strong kidney cleanse for water retention and for the reduction of fluid in treating stress-related conditions, and also to treat nociceptive pain syndromes. Basically achy body, achy joint, achy back, whatever it is. But this would be a more long-term way of treating things. And so sandalwood would be a component of that. Right off the bat, you hit them with diuretics. And so I didn't talk about it in the normal pain class because it's already so much information. So I thought we'd cover it in some free study groups where we talk about like advanced pain management. So even if you haven't had the class, we'll still, you'll still be able to kind of keep up. But I would reduce the fluid retention. I mean, it can be caused by medications. It can be caused by stress. It could, it sounds like she went through a lot, so that could do it.
Yeah, she
Could be through irregular sleep. It could be,
she doesn't
sometimes
sleep
even,
well.
yeah. So I would, even though it's not specifically symptom oriented, I would do things to try to regulate her sleep. If you get her sleep regulated, her body will start to heal itself to a much higher degree. And then you're not chasing so many symptoms around. And then what was the first one? I can't remember now. We talked about the low blood pressure. And
Yeah, low pulse, and then the acid reflux.
Oh, acid reflux.
Yeah.
So probably the easiest thing to do is just get her to drink some aloe vera juice for a few weeks, and that should calm it down. From there, I usually do some things to treat the liver. It's not always liver related. Sometimes it can be pancreas related, or even just good old fashioned stomach related. But also the hyssop should release the diaphragm if the diaphragm's impacted. The next thing I would do after it starts to calm down is start just treating liver, just kind of clean the liver up. So there you have several choices.
Would that be the mushrooms?
You could, mushrooms, probably not so much. I mean, I'd probably go to like Greenland moss, helichrysum, goldenrod, even carrot, or just lemon. Yeah, lemon takes the longest, but it's tried and true. You just have her drink lemon water every day for a while, and a lot of times it can clean the liver up somewhat. Especially lemon's really especially good if there is a higher viscosity of the blood. Either through dehydration, which if she has water retention, she also has a little bit of dehydration, right? Like her kidneys aren't balancing the fluids as well as they could. And the lymphatic system would pick up the excess fluid and get rid of that fluid via the kidneys. And so, kidneys and liver are the two things I'd really target for this person. I think it would make her feel better. Cleaning the kidneys up will make her think like quicker. Her mind, like sometimes when you ask somebody a question, they go, and then
like
their mind kicks
fog.
in. Yeah, that is lymphatic and kidneys. Like the kidneys, it's almost like they're, the way that we used to learn it was the kidneys are drowning in fluid. It's not really the case, but it just helps you remember that that's kidney oriented. And it could be that the kidneys just aren't releasing the fluid from the lymphatic system that the lymphatic system picks up. But if you go through and do that, their body usually feels better. They lose some of the fluid. They'll stop cramping if they have some cramping issues. And the lymphatic system starts working better. And if that's the case, you might be able to reduce the reflux and all of that just by treating the liver. And sometimes you got to go into the pancreas, but
Now, are
the
these
pancreas can
just
get in, the
Yes.
pancreas can get inflamed and start
Oh.
to cause some disruptions and like the friendly bacteria in the gut and enzymes, especially enzymes. And so I usually don't treat that right off the bat. I usually go through and treat these other things first. And then if it's just not responding, then I start tackling the pancreas. And so
just a couple drops of these oils in water? Is that what you suggest?
for the diuretic, sandalwood, a
the-
couple drops in water,
Okay.
and just have her shoot it down. The lemon, some of the other oils for the liver, you could get away with doing topical things like kind of over and around the liver, but
Mhm.
it is quicker to have her ingest them.
Okay.
Lemon is best just ingested.
Okay. Now,
Yeah.
if I were to do essential oil application along the crown along the spine to the sacrum
Mhm.
by layering different oils, what do you
Yeah,
suggest?
yeah.
Can I use?
Ooh, that's a good question. I would probably use some chakra root cleanser. I'd probably use some marjoram to open up the spine first, and then follow it by some chakra root cleanser.
Okay.
And then maybe some lovage.
Lovage, okay.
Yeah, just to support the work that you'll be doing with the kidneys.
Okay.
A lot of fluid can be retained in along the spine.
Mhm.
And the other thing that can happen is the synovial fluid. It has like these little synovial sacs all along the spine. When the back gets really tight, or there's a lot of fluid retention, or fluid's not moving really well along the spine, they can actually kind of thicken up and even eventually turn into a cyst. And so you're putting the marjoram on to open up the muscles so that things can start moving. The chakra root cleanser will have an energetic cleansing effect, but it will help move lymph. And
Okay.
then you follow it with some lovage after that, and it will help flush things out of those little mini joints there.
Okay.
I like that. If you don't have lovage, you could also use the Arthra Care.
Okay. I do have lovage.
Yeah, okay.
Mm.
Yeah.
Any other
And then
oils to
you could
layer?
also, like as you go through and put it on the spine,
Yeah.
kind of do like soft, like you're moving your hands both outward.
Yeah,
like
I
you
do
kind of
that.
get into the tissue. Yeah, like
Yeah.
the term is called ama. Like it's
Ama,
like
yeah.
ama massage. Yeah.
Yeah.
Really good for along the spine.
Yeah.
Yeah.
Yeah. Okay. And for the depression and like
The
pain?
depression, could be due to this function, but we could always go to, if she's had a lot of difficulty, you could use St. John's wort.
Okay.
The only thing that I would say is to take into account that St. John's wort will drain medications out of her body.
Mm.
And so if she's on medications, I'd probably not do St. John's
Okay.
wort. But the easiest thing to do would be, and again, it's another internal one, would be cinnamon. If she didn't want to do that one internal, if you feel there's too much going on, you could have her inhale it or diffuse it in the room, like, where she's always going to be at.
Yeah.
And it will take a little bit longer, but it will work. Depression can be because of the physical body being tired and worn down, fatigued, which would go along with the kidney function. Or it could be psychological issues. Still, that would help integrate things into the heart to help her process. But a lot of times when you look at depression is too much like inward thinking or awareness. They're too introspective. And so cinnamon helps them to be a little bit more outwardly driven and outwardly expressive. And so, it helps them not focus completely on themselves and how they're feeling. And two, if there is a problem that they're having with somebody in the environment or, a situation, they're looking more outwardly and they have a greater tendency to work those things out because they're expressing, they're interacting with the environment and they're expressing. And so cinnamon can work really, really well.
Okay. But don't apply it because that's hot, right? Okay.
Yeah, it will cause a little bit of like a red spot
Irritation.
or even a little bit of a rash. Yeah.
Okay.
Yeah.
How about splendor?
I mean, what is it?
Splendor.
That will help if it's psychological in nature.
I think I have a feeling part of it is psychological for her.
There's a good chance it is. I mean, if she's had a difficult time and
Mhm.
yeah.
Okay.
I mean, that's the thing with some of these things, like you kind of go through and treat and you wait to see how the person reacts. It's a little bit harder. Like you kind of have several tools and you just start applying them and you just wait for something to pop.
Okay.
And like when it's a more simpler situation, you can kind of rely on almost a template approach. But when it starts to be multiple things, because there's some psychological components in there too, and we're not always sure how each person is going to react. So it's almost starts to become like you have this toolbox, but it's a case by case basis.
Yeah.
And you start just treating and waiting for them to find the thing that they connect with.
Okay. All
I treated this lady one time. She had she had just crazy sinus infections. I mean, it wasn't just stuffy nose. I mean, she was having really gnarly sinus infections. And I mean, I must have tried 10 different things that usually would just knock that out. And, none of it worked. Like not one of them worked, not even a little bit. And I mean, I was beside myself. And so I sent her home one time with myrrh, just as like a long shot. And myrrh knocked it out. For most people, myrrh wouldn't have knocked it out. But for her, for some reason, it did it. And so like, there's multi-causal factors for a lot of these things. And some of them are things that don't present in your interaction with them. So, that's where intuition comes in. That's where, you just ask a bunch of questions. And sometimes I'm not even sure, like I'll ask questions and I'm not sure how it fits in until later. It's like it might not be part of what dictates what we should do right now, but as things don't quite pan out, then it starts to play more and more of a role.
That makes sense.
Yeah.
Can I ask one more for one
Yeah,
more
fire away.
client?
Yeah, this
Okay.
is no, you're good.
Okay, so the other person has several things going on. She has diabetes, diverticulitis, colitis, low thyroid, and overweight.
Okay. So let's do the colitis and the diverticulitis first. So
Okay.
diverticulitis, we know that there's a diet that she should kind of follow, meaning things to avoid, like seeds and popcorn, things like that,
Okay.
because it's going to aggravate it. If she has a diverticulitis flare-up or a colitis flare-up, the best thing you can do for her is give her a couple drops of yarrow and water daily. Usually it's about a week. They'll feel within a day or two, they'll feel more comfortable. But a week usually knocks it out. And so the thing that's great about yarrow is it will reduce the inflammation. And if there's a little bit of bleeding, like sometimes the tissue gets so inflamed that it actually starts to bleed a little bit, it actually will stop that bleeding. Be sure that they drink it in water,
Okay.
not even an oily substance, like it needs to be in water.
Okay.
If they don't want to do the essential oil internally, you can have them go on Amazon and get yarrow capsules. you know,
Okay.
instead of the tincture, because it needs to get further down than what a tincture would do. You know, tincture will hit your bloodstream a little bit up high. We want it to go through the digestive tract. The
Digestive.
oil in the water gets it, you know, the essential oil in the water gets it down to where it needs to go. But the tincture, it's hit and miss.
Okay.
So with that, anytime they have a flare up, this is always good. Now, the downside of this is they can't take it super long term to prevent things. They could take it up to about like 3 weeks if necessary. Usually they don't take it that long. Usually it's about a week to 10 days. But after about 3 to 4 weeks, it starts to diminish your body's ability to absorb or produce like iron. You know, it affects iron levels. And so eventually it could cause, you know, a little bit of an anemia. And so, you know, they can take it 2 weeks and be like maybe a week off and then 2 weeks again, and that should be fine if they want to take it more long term, but they need to have breaks.
Okay.
Yeah. And so remind me of the other parts. So there's the diverticulitis and colitis. And
Diabetes, low
Yeah.
thyroid, and
low
overweight.
thyroid.
Yeah.
Let me check my note for low. I mean, I think I have an answer, but I just want to check my notes to make sure I'm not.
Okay.
They'd probably give this person for that, as long as they're not having an outbreak of the colitis or the diverticulitis. 1 or 2 drops of clove bud in water. You can do it topically, but it needs to be highly, 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 highly diluted. You know, because clove can be very irritating to the skin. Yeah.
Mhm.
And so if they don't want to do it internal, you know, just dilute it in a massage oil or something, have them rub it on their neck area. But that should help to balance out the thyroid. Diabetes with essential oils, there's not a great way to treat diabetes with that. You can help to undo some of the effects, but really to do diabetes, probably go to the herbal world and use something like bitter melon. Bitter melon works relatively good for that. Are they doing insulin or the pills or anything like that?
Yeah.
Yeah.
She's on a lot of different medication. Yeah.
Yeah. I tackle the other things first because that one's going to
Yeah.
be a long-term treatment for the diabetes.
Yes, definitely.
Yeah.
Okay. Very good.
And then let
Thank
us
you
know
so
if there's
much,
any
Greg.
difficulties. Yeah. If you need to
Yeah.
troubleshoot something or those are good places to start, but sometimes you still have to adapt. So let us know.
Okay, I will. Thank you so much, Greg.
You're so welcome.
Go ahead, Sue.
Hey, Sue.
Hi, Greg. How you doing?
I'm doing pretty good. How about you?
Good, good. I have a question about my sister-in-law. She's 72 years old and has really bad neuropathic nerve pain in her hands and feet. And
Okay.
this started after having chemotherapy for ovarian cancer. And
Okay.
she's not getting good sleep at night. And the cancer's almost gone, but they're going to be doing a hysterectomy in another 2 weeks.
Oh.
But she's in really bad pain, so she's not getting good sleep. And this weekend in class, I had someone ask the question to you what oils to use, and you said to use galbanum internally,
Mhm.
and then rotate neuropathic pain relief and lymphatic blend.
Right.
My question is where and how to apply the blends. Do you put it between the toes, a liniment on the feet?
No, you would make it in like a massage oil, like about 20-25 drops per ounce. So you're making basically an ointment, and then apply it to like the hands up to the elbows and the feet up to the knees.
Okay.
Yeah.
And her daughter has dabbled a little bit using
Okay.
oils for her children's allergies. So, and they're also thinking of going to get CBD for her.
Yeah.
Would that interfere with the CBD?
No, it wouldn't interfere. I mean, it might help, it might not. It couldn't hurt. It might help her sleep. But the thing is like when you have neuropathy, it's a sensory nerve issue. And so sensory nerves are always impacted by poor lymphatic movement. And so the lymph oil is to help try to move the lymph in those areas. And so when the area is lymphatically stagnant, and makes your nerves fire 5 to 10 times like faster, so it sends more pain stimuli to the brain, and so it intensifies pain. And then the nerve pain is just to take out the tension in the body and to block some of those sensory nerve impulses going to the brain.
Okay.
So she can rotate back and forth. The thing with the galbanum is it usually helps to shift the pain threshold a little bit and take some of the tension out of the body due to pain. It usually eases the pain, cuts it down anywhere from 20 to 50%, just because of what it's doing. How the brain processes the pain. And so that can be helpful. The other thing, I mean, we're talking more long-term, what we were talking about earlier with the kidneys and the liver, especially for chemo patients, liver treatments. We usually do that, but that's not going to impact so much the neuropathy, but it will just help our body to function more. But I'd kind of wait for that after she's done with her surgeries and everything. Not that it would complicate any things, but it's already a bunch that she's got going on. And like, we have to kind of also temper that we don't want to overwhelm a person, because when they get overwhelmed, they'll just stop everything. And so we want her to have a treatment protocol that brings her some relief. She gets through some of the stuff that she's going through. We can start to augment some of the things we're doing as far as going after the liver and kidney and cleaning that up and looking at her long-term health a little bit more than what's just happening right now. But let's get her out of pain.
Yeah, so you're saying right now, just use the oils, don't use a protocol treatment.
Yeah, I would keep it relatively simple. Yeah.
Okay.
It's very easy to get overwhelmed because they got so much going on, and there's usually a lot of fatigue when they've gone through what they've gone. And so you're not going to get, it's hard to do a bunch of things because it's almost like you need to feel a little bit better to do some of these other things because it's a little bit more involved. Get her feeling better first.
Okay.
Yeah.
Thank you.
And if it doesn't, if it's still not cutting everything, let us know, but that should really bring her some relief.
Okay. Thank you.
The issue is, it's chemo related. So if her body's not processing the chemo as well, I mean, there might be some sort of detox we might need to do. But first, I usually like to do that from a place of stability rather than, she's already tired, she's already not feeling good, and then put her through a detox. Not always the greatest thing to do, but sometimes you still have to do it. I'd try this first.
Okay.
Yeah.
Greg, this is Miriam again.
Hey.
Hi, how are you? It's still warm up here. I just texted with my friend that I was telling you about, and she said when she was 9 years old, she was hit by a pickup truck and dragged for a while, and she
Yeah,
was
that's
unconscious.
what I'm looking. That's what I'm looking for. Yeah. So I would treat the spine with like marjoram for a little bit, and then I would probably use like some terebinth, like on her head. Like she could shampoo her head and get it all over her head. You know, if she doesn't want to do that, you could put it in alcohol and have her rub it into the scalp and on the jaws and, you know, base of the skull and the neck. And then also you could do healings, delicate regeneration on the brain in between the two hemispheres. But she was dragged.
Yeah, apparently the driver didn't know that she,
Yeah.
and she got caught on the bumper. Her
Yeah.
clothing got caught.
And so she was face down or face up?
That I can't, I don't know.
Okay, that's okay. It probably wouldn't matter because she was probably moving her head around. And so, you know, when you're doing healing and you're looking at the brain and then there's the bone, do healing on that space between the brain and the bone.
I'm not getting that word, between the brain and the
Bone. Like
bone.
the skull. Yeah, the skull.
Okay.
Because what happens with concussions, and if she was dragged like that, I'm gonna guess that there was multiple spots on the brain, is they get like they call them lesions, but it's basically like a knot in your muscle. It's in fascia. And she probably has, you know, half a dozen or a dozen lesions on the brain.
So, okay, so should she also do the brainwave, the vital, the first recommendation that you
Yeah.
made?
Yeah,
Both. She should do both.
Yeah.
Okay. And
We're gonna unwind the lesions. I mean, helichrysum would work. It's just it's a bit more expensive, and it's gonna take a while.
Mm-hmm. Okay, and on the marjoram on the spine, we're talking direct application. Neat.
Yeah. If she can, if she doesn't have anybody who can do it, at least on the back of her neck, and then have her hit somewhere low on her low back.
She can
have her hit.
Yeah,
Hit.
someone will do it for her.
Okay, good.
Yeah.
Do
Okay,
that
great.
daily. Yeah, daily for at least a couple of weeks.
Okay, great. Okay, thank you.
You're so welcome.
Go ahead, Megan.
Hey, Megan.
Hey there. We miss
Hey.
you already here in Austin. So I was going through my Angels books, and I had just a quick question for you. In Angels 4, there is an introduction to the vital centers and the brain through doing angelic work and working through the heart, the navel up to the crown. And I was just wondering, because each segment you have it where it's associated with the angel, but you also have just up top what vital center it's associated with. And I was just curious if you could just speak on how they're connected, and if the vital center oil would be sufficient, or if it's just working with that specific angel.
Just working with that angel. That was Vital Center's light. You know,
I
that
see.
was to get people kind of used to the idea and starting to walk that direction. And if somebody didn't do the vital centers, at least they had that when working with the angels. The vital centers definitely super augment or enhance you know, the practice of theurgy or working with angels. I would almost say it's not mandatory, but it's, I mean, it makes it so much better that it is pretty necessary. And so it was just a way of doing it kind of in a light way in that class.
Okay.
If you have the vital centers, do the vital center class. It's so much stronger.
Okay. And then if
Yeah.
I wanted to do angel work thereafter, I could maybe focus on that, the angel afterwards.
Right.
Okay. And then would you recommend then, when we work with angels, would you recommend, because there's so many different beautiful ways in each class, is there a specific one with the level that we've gotten to at this point, a particular class that you would prefer or that you would recommend?
Three or four. You know,
3
you
and
could
4?
jump up to 3 or 4. And I think,
Okay.
did we do a 5 or no? I can't remember.
We did as a,
Yeah, you could do 5 as well.
okay. Yeah, we did a, it was like a free weekend thing, but
Right.
yeah,
Yeah, sounds familiar. Yeah.
yeah, cool.
We have another angel weekend. I can't remember when it is, but it's coming in the next few months.
Okay, well, I'll be there whenever it is.
How's married life?
You know, it has been surprisingly more amazing than I even thought it would be.
Good.
We've actually had a family get together so far, and he's been very sweet and helpful around the house, which is wonderful. And at any rate, it's phenomenal. So thank you for
Good.
asking.
Good.
Question, I have a groin pull on the left side. I have a doctor's appointment tomorrow. I've been applying marjoram for the past few days, 2 to 3 times a day. Any other suggestions?
I need to know a little bit more information. So first off, how did it happen?
And you can type in if you don't want to unmute yourself. They're not sure how it happened.
Oh, it just kind of popped up. Where exactly is the pain? Like, I know you say groin, but is there pain in the hip, in the low back? Is there any other areas of pain?
Hey, Greg, this is Chris. It's about the groin pull. Yeah, it's mostly on the left side, but then every once in a while it does wrap up to where it feels like it's on the hip, but it's when I've actually paid attention to it, it feels like it's under the hip joint, and then sometimes it wraps back around like it's heading into the glute on the left side. But the pain is predominantly in the groin area, and then makes it a little difficult to walk. And then when I've overdone it, that's when I start feeling it going up into the area around the hip.
Okay, not to get super personal, but I'm gonna get super personal. Do you have any pain in the same side testicle?
No.
Spare some.
And are we sure that the hip hasn't been elevated? You know, one side of your hip being super elevated for a few weeks, a month, 2 months?
No, I go to my chiropractor every 3 to 4 weeks, and I saw him last week, and he said my hips were fine and my legs were even before he adjusted me.
Okay.
So, you know, I do a lot of I do a lot of walking in strange spaces at time for my work. And then I started, now that they lifted the COVID-19 restrictions, started going back to the gym and was on the elliptical machine, but, you know, not doing high impact, just doing the kind of like the fat burning mode where you're low impact, you know, low RPMs. And I always stretch beforehand. So it just kind of appeared out of nowhere and progressively has gotten worse over the last 2 or 3 months.
And so one second, I'm looking something up at the same time. The elliptical, are you moving your, like, bringing your legs up harder or pushing down harder?
On the elliptical, it would be pushing down harder, but again,
Pushing
it's low RPM mode on it, so it's not like I'm in a running mode. It's kind of more like a medium to fast paced walk. So I'm trying to keep it low impact on that.
Okay, give me just a second here. Any pain down around the knee?
No, it's mostly concentrated right in the groin, and you know, when I'm more active, just like I mentioned earlier, it starts to wrap around to under the hip joint, but
Any
it doesn't
pain up
travel
on-
anywhere else.
Any pain or uncomfortableness, heaviness down in the lower abdomen?
Nope.
I mean, you only have some of the symptoms. With it being more of a downward motion with it flaring up. You are saying like the SI joint is being impacted a little bit?
The SI joint, sorry, don't.
Yeah, sacroiliac joint on the backside.
Once in a great while, I feel the pain or a twinge traveling, you know, towards the rear, but it hasn't. I probably counted on one hand the amount of times it's been over the last few months.
Been more on the front. Okay.
Yeah.
Well, could be, like you said, could be a groin, could be your psoas. You don't have all the symptoms for a psoas issue, but with you doing the exercises that you're doing, I would think that it would be more your legs being drawn upward rather than pushed down. You're not fitting all the situations, but I would have you probably, just as a for sake of experiment, do some long, slow, deep breaths with like some form of hyssop or spruce, like Sitka, something like that, and then do a really gentle, what's that, cobra? Like, you know, where you kind of push your upper body up and just totally relax as much as you can. You know, don't engage the flex reflex at all, the stretch reflex, and just passively try stretching the psoas and see if that changes some of that. I mean, you can try to treat the psoas with a little bit of oil, but it's so deep that it usually doesn't reach the area. And if it was an adductor, the marjoram should have helped. Are you still being active?
I've stopped about 2 weeks ago was the last time I did anything.
Okay, so you've been
on the
off 2 weeks
machine.
and it's still flaring up.
Yeah.
Yeah.
'Cause when
I would try the stretch with the psoas, and then I'd maybe switch over to something that has like nerve pain, you know, something with peppermint in it, you know, or birch, you know, something that has a little bit more of a pain relieving property to it, just to help take the pain down and take out some of the body tension as well. But I would still try doing the hyssop and the really passive cobra pose. Do that for like 2 or 3 days and then maybe email us.
And the peppermint or birch, is that inhalation or is that
No,
application?
that would be application to the groin area where the pain's at. So
Oh, I'm sorry.
you-
I thought I was unmuted. I was asking the peppermint. It would be a straight application to the affected
yeah,
area.
I'd put it probably in a little bit of lotion or oil. Hey,
Okay.
give me just a second. I need to go take a bathroom break real quick. Give me-
Thank you.
Okay, anybody else?
Kidneys are showing symptoms of distress. I think this is a different one. Yeah. Let me see if there was something earlier that this is correlated to real quick. All right, I think it might just be someone having a question then. It said, someone with kidneys who are showing symptoms of distress, dark urine, then 2 days, it felt like I slept wrong in the kidney area, slight watery tinged urine when blotting, discomfort in kidney area consistently for 3 days now, drinking hot water, lemon water, room temperature all day with frequent urination.
And how old's the person?
70.
70. Okay, and so this has only been going on for about five or 6 days?
Or 4, maybe 5,
4.
first day. Yeah, I just noticed it was really dark and I drink a lot of water. And then, you know, it's been slowly progressing. And now it's not real bad. I just kind of, it's uncomfortable. It's not where I can't function or anything.
Mm-hmm.
Yeah, but now there's a little bit of blood tinged, just slight tinge. It's not even, doesn't even look frank, you know?
So there's a little bit of blood in the urine.
Yeah. And the only way I know that is because the little panty liner had a little tinge of it in there. You can't see it in the urine. Before it was really dark and then it lightened up because I was taking I just now did a little bit of sandalwood in my water after earlier talking.
Okay, give me just a sec here.
Sure.
Do you have any St. John's wort?
No, I do not have St. John's wort. I've got a lot of things, but that isn't one of them.
Maybe let's have you get some St. John's wort from just the health food store, like in a capsule.
Oh,
Just get like the smallest bottle.
okay.
And are you on any other medications or anything that's internal medication?
Yeah, Q12, a cardiac arrhythmia, keep my cardiac, the timing mechanism working.
Yeah. Okay. Let's skip the St. John's wort. Let me think about this for a little bit.
Okay.
It's possible you might have a little bit of an infection.
Yeah, that's, I did just, while I was waiting, I called the doc to say, can I just have a urinalysis, you know,
Yeah.
just to look
Let's
at
do
that.
that. Let's do that and see what they say. And I mean, there's a couple different things we could do. St. John's wort is actually really good for kidney infections, but with your other medication, I'm not comfortable having you take it.
Yeah, okay.
So
I'll
let me
look at
think
that
about
and
it.
see. Yeah.
Let's see what the doctor says. And sometimes with especially if it's chronic or low grade, the Moroccan thyme can help knock that out, and sometimes even myrrh can help knock it out. It's just they're slow. St. John's wort would be faster, but let's see what the doctor says. Let's see what the urinalysis says, and then we can go from there.
Is it okay to do the drop of in a sandalwood in water in the meantime?
Yeah, it should. Yeah, it should be. Yeah, it should be.
Okay, sounds good. Thank you,
Okay.
thank you, thank you.
Yeah, keep us posted.
Okay, doke.
Go ahead, Kathy.
I have been diagnosed with leaky gut, so I'm not sure what to do with that just recently.
Okay, so like tell me some of the symptoms that we're presenting. I mean, I know leaky gut, but I just want to make sure that we're on the same page. Tell me some of the symptoms that we're presenting.
Well, mostly I showed it to a nutritionist that I consult with, and I had a very unusual, like my functional medicine said it was a really high bacteria. She'd never seen it that high. And then it was a Nutra-Eval stool test that I showed him that had some other markers. And he said, you have leaky gut. I go back and forth a little bit with loose stools. Not a lot for how long I must have had it. You know, that's recent. A little bit of bloating, but I don't have much discomfort, really. It was more that test that pointed it out.
Okay.
He just looked at those results and said that I had it. And I think my functional medicine probably said I did, but I haven't really noticed it as a symptom other than I'm focusing on getting better.
So this is what I'd like to probably just start out with. And I don't think this is going to be the complete treatment, but I'd almost like to see where this takes you a little bit. I'd like you to do like maybe a couple drops in water of Palmarosa every day. Doesn't matter what time of the day. I'd probably do it in the morning, but if you do it at night, no big deal.
Well, I started that after my call last week because I knew I had this bacteria.
Okay.
I didn't know about leaky gut. So I started 2 drops in water of Palmarosa.
So let's have you continue with that. But then let's also have you, I'd like to have you take wormwood internally, but the essential oil is not good for you to take internally. It's too potent and it would actually be a little bit toxic to the system. So I'd like you to go like on Amazon and get wormwood capsules.
Capsules, okay.
Yeah, not the tincture. Oh boy, the tincture is pretty hard to take internally. So just get the capsules.
I don't know, is it worse than Monarda? Because I have a Monarda.
Yeah, Monarda will become tasty to you after doing wormwood tincture. Wormwood is like one of the most bitter substances there is in the herbal world.
Oh, you scared me.
Yeah. So let's have you do like maybe a week to 2 weeks of like 2 to 3 capsules a day of wormwood, and see how that treats you. Yeah. It's not going to be the complete treatment, but it should help calm the nerves. It's very soothing. It helps regulate some of the nerves in the gut, and it will also regulate those bouts where it's a loose stool and things like that. And once those things are a little bit more cleaned up, it'll be a little bit easier to treat whatever else is going on. So let's have you start with that.
Okay, and last week you mentioned something about after a couple of weeks, do spikenard also with Palmarosa.
Yeah, that would still be on the table. That's what I was actually even evaluating that right now. So I would still say that's a couple weeks out, but Palmarosa for right now, and then let's add the wormwood.
Okay.
Yeah.
Thank you.
You're so.
What's the best way to use parsley soap?
Parsley soap is try to use it in the shower or bathtub.
What does it do?
No, I'm joking, obviously. So parsley soap is just good for helping to regulate the skin, clean up the skin, and by cleaning up and regulating the skin and some of the functions in the skin, it also improves the immune system. Parsley baths are super nice, by the way. Like 12, 15 drops in with some salt, about a pound of salt, and really good for the skin. Can also be helpful for some skin issues. like if you're prone to psoriasis or eczema, things like that, can be very helpful for that as well.
When you mentioned lemon for the person, did you mean lemon juice and water or lemon oil and water?
You could do either one. Yeah. I mean, lemon oil is a bit stronger, but hey, lemon juice works good too.
The gums on the roof of my mouth are super sensitive. I don't know what caused it, but it feels like I burned it from eating hot soup, but I didn't. Is there any oil I can use to heal the sensitivity?
Are you having any kidney issues or water retention, anything like that? I know it's a weird question, but
No kidney issues.
okay. Two oils would come to mind. One would be bay laurel, another one cypress, and you could gargle. You could also drink a little bit of the water and then gargle with the, swish it around your mouth a whole bunch. You could even take a few drops of the cypress and rub it up on the roof of your mouth by itself.
They have cypress.
Okay, good.
We'll be getting the parsley soap up on the website soon.
Yeah.
I was told there was a difference between Epsom salt baths and kosher salt. Which is better?
Depends on what you're trying to do. Just regular salt is a little bit better etheric cleanser. Epsom salt is a little bit for taking like tension out of the body, relaxing muscles and achy joints, things like that. So a little bit better for muscular issues and things like that. So depends on what you're trying to do. If you're not sure, mix a little bit of both.
How many drops of parsley essential oil would go in a salt bath?
12 to 15 drops.
Unless somebody else has any questions, I think I got all you guys there.
Okay, so let's do, this is a way to basically release some stress out of the body, which, it's not just like you doing your normal thing or you have some obstacle, or basically if you're doing a spiritual practice, a religious practice that's real intense, you're having to change a lot in say the workplace or because of something going on in your body or in a relationship. This has more to do with your body being able to handle a lot of change, right? And so we're going to be talking about stress and the lymphatic system to a much deeper degree at the end of the month of July. But let's start to dabble with this a little bit. And so, okay, this first application, here's some choices: galbanum, tarragon, or the Vital Center corpus callosum.
Yes, I did spell galbanum wrong, guys. Just so you know, if there's has something else on it. If you don't have any of those oils, type in for me.
Yeah.
Someone, oh no, they have tarragon.
Okay, we're good.
No one typed in that they didn't have.
Okay, so let's begin inhaling. Your awareness is on your forehead. Long, slow, deep breaths through the nose. Exhale through the mouth. Your awareness is on the forehead. Move your awareness to the bottom of the tailbone, the basic chakra. Move your awareness to the hips. Your knees, your front and back knees. Then your ankles. The soles of your feet. The armpits. The elbows. The wrists. The palms of your hands. Your front heart. and your back part. Just be still, be aware, keep your eyes closed, and just be still. Now, choices for the next application. Marjoram, spikenard, vetiver, valerian, or lavender. And then the blend from the Vital Center class, Thalmas. No, excuse me. No, yeah, Thalmas. Okay, so begin inhaling. Your awareness is on your navel. Long, slow, deep breaths. Your awareness is on your navel. Your awareness is on your sex chakra, where the sex organs are. Move your awareness to the front solar plexus. Move your awareness to the back solar plexus. Awareness is on the back solar plexus, your mid-back area. Your Ming Men, your low back area opposite the navel. Move your awareness to the front heart. Move your awareness to the back heart. Move your awareness to the spleen on the left-hand side below your ribs. Move your awareness to the area between your eyebrows, the ajna. Just be still. Be still, be aware, just let go. Keep your eyes closed and let go. Okay, let's see if you have any of these for the third one, third part. Palo Santo, eucalyptus, well, let's just say any eucalyptus, but globulus would be your first choice. Mugwort, or the blend's chakra root cleanser. Vital Center blend, cerebellum. Okay, so begin inhaling. Your awareness is between your eyebrows, right where we left off. The ajna. Move your awareness down to the spleen on the left-hand side below the ribs. Your front heart. Move your awareness, we're on the spleen. Yeah, move your awareness to the front heart. Move your awareness to the back heart. Your awareness is on the back heart, between your shoulder blades. Move your awareness to the Mingmen, opposite your navel, but on the back side. Down to the Mingmen, or you're already on the Mingmen, I'm sorry. move to the front solar plexus. Your back solar plexus, your mid back area. Your awareness is on the sex chakra, where the sex organs are. And then your navel. And then be still and be aware. Just let go for a moment. Okay, here's the choices for the last step. Kava kava, saffron, any type of rose, dwarf pine, sitka, the blend angel cornel, the blend de-stress, or the vital center blend fornex.
And just let us know if you don't have any of those. This person has the AMS article. Yes, he said Angel Cornell.
Same again. We'll try that one. Okay, begin inhaling. Your awareness is on your crown. Move your awareness to the right sole of your foot. Your left palm. Your right palm. The left sole of your foot. Your crown. Just be still, be aware. Begin inhaling again. Your awareness is on your crown. Your awareness is on the left sole of the foot. The right palm. Your awareness is on the right palm. Move your awareness to the left palm. Your awareness is on the left palm. The right sole of your foot. Put your awareness on the crown. Just let go. Just be still for a moment. Just let go. Okay, how do you feel? And give some feedback. Can either unmute or type in. Have time for just one or two maybe comments.
Someone shared, I was feeling a bit stressed and definitely fiery all day. Now I feel soft and smooth inside.
Yeah.
These oils, holy moly, softens the edges a lot.
Yeah, they do.
Another said, blessed.
Yeah.
I used the Vital Centers oils for the first time. Hi, Greg. This is Susan.
Hey, hey, how are
from
you?
Austin. Boy, they pack a punch, huh?
Mm-hmm.
They're wool babies.
Yeah.
Whew, thank you for sharing.
You're so welcome. Thanks for everything this weekend too, by the way.
I had fun. I hope you did.
Yeah, I sure did. Yeah.
Someone else shared warm and alert.
Yeah. So it's a way to release a lot of stress very, very quickly.
Wow, this really helped me. I was so fired and now feel back to myself.
Yeah.
Fried.
Yeah.
Yeah, that's what the other person said too. I'm just reading things dyslexic. No, the other one did say fiery all day.
Yeah,
This
yeah.
one did say fried. Punches in all the right places for sure. What was this protocol for?
Releasing stress. We're going to talk about stress, the lymphatic system, and some forms of pain at the end of the month, mostly stress on the lymphatic system. But we're going to do a free class at the end of July. And we'll be using vital centers, potentially some brainwave activity, stepping it up a notch. So, and it's a nice free class. Okay, guys, I got to get rolling over into the next meeting, and hope you enjoyed tonight, and keep us posted on the ones that we were helping with treatment plans. And love you guys, and I'll talk to you soon.
Thank you, Greg.
Take
Thank
care.
you, Pam.
Yeah.
Love you both.
Love you guys.
Bye.
Thanks, Greg.
You're so welcome.
Thank you.
All right, thanks guys.